Diabetes mellitus is the name given to a group of metabolic disorders which result in high levels of glucose in the blood. Known popularly as high blood sugar, there are several types and several causes of diabetes. All types, however, often have similar complications, such as increased risk of damage to the kidneys, eyes, and blood vessels. Diabetes is one of the most common diseases in the world, and its incidence has increased over the years, mainly due to poor diet and obesity. What is glucose? Glucose, also called dextrose, is a simple carbohydrate molecule whose main function is to provide energy for the cells to function. Virtually all foods of the carbohydrate class have glucose in their composition. Most carbohydrates in our diet are composed of three monosaccharides: glucose, fructose, and galactose. Examples: the famous table sugar, called sucrose, is the junction of only two monosaccharides, glucose and fructose. The carbohydrate present in milk, called lactose, is the junction of glucose and galactose. Our body needs glucose to function, it is our fuel. In fact, from bacteria to human beings, we need glucose to survive. Glucose is the only carbohydrate molecule that can provide us with energy. Both fructose and galactose must first be converted into glucose by the liver in order to be used by the cells. Blood glucose control role of insulin. After a meal, the carbohydrates that have been eaten will go through the process of digestion. Digesting a carbohydrate means breaking it down into several micro pieces until all the bricks of glucose, fructose, and galactose are released. In the small intestine, these molecules are absorbed, reaching the bloodstream. After a meal, a large amount of glucose, fructose, and galactose reach the bloodstream, raising blood glucose, which is the concentration of glucose in the blood. Whenever there is a rise in blood glucose, the pancreas releases a hormone called insulin, which causes the circulating glucose in the blood to enter the cells of our body. Insulin also stimulates the storage of glucose in the liver, so that in times of need, the body has a source of glucose that does not depend on food. These two actions of insulin promote a rapid drop in blood glucose, causing glucose levels to normalize quickly. What is diabetes? Diabetes mellitus is the name given to the group of diseases that result in the body having difficulty controlling blood glucose levels to keep them above normal. We say that diabetes is a group of diseases because there is more than one type of diabetes, with different causes and different mechanisms for the dysregulation of blood glucose levels. Usually diabetes is caused by a lack of insulin production, or by an inability of the cells to recognize the presence of insulin, that is, there is insulin, but it cannot get the glucose into the cells. There are even cases in which the patient has both problems. Not only does he produce too little insulin, but it also malfunctions. The end result of this reduced or malfunctioning insulin production is the accumulation of glucose in the blood. The patient eats, receives a load of glucose in the blood, but the cells cannot capture it, keeping the blood glucose constantly high. This high blood glucose, called hyperglycemia, causes two major problems. The first, in the short term, is the lack of glucose in the cells, which need it to function properly. The second, which occurs after years of illness, is damage to the blood vessels. The excess glucose is toxic to the cells of the vessels, causing the arteries to be progressively damaged, leading to the typical complications of diabetes, such as kidney problems, blindness, cardiovascular disease, neurological damage, gangrene of the limbs, etc. There are several types of diabetes, but three account for the vast majority of cases. They are: Type 1 diabetes, Type 2 diabetes, Gestational diabetes. In the next video, I will explain in detail all about these three types of diabetes. So subscribe to the channel and activate the small bell to receive all the notifications. Until the next video.